Hello everyone, this is my next topic for today. This is a 5 marker, has been asked a lot of times, 2 or 3 times in the PYQs, and it is an important 5 marker from the bone chapter. So the name of the topic is Cleidocranial Dysplasia. Now let's see what cleidocranial dysplasia is. It is a hereditary disorder of bone. Okay, so unlike your fibrous dysplasia was a developmental disorder. This is a hereditary disorder of the bone which has an autosomal dominant similar to your cherubism. This is also autosomal dominant, and there is dental and clavicular abnormalities. Let's see what are the etiopathogenesis. So there is a mutation in CBFA gene. So CBFA gene. There is a mutation in this gene on chromosome 6p21. Okay, so there is a mutation in the gene CBFA on the chromosome 6p21, which is the root cause of the disease. Even if you don't remember on which chromosome, you have to remember the name of the gene, that is CBFA. Okay, CBFA1 is the name of the gene, which has a major role in formation of osteoblasts, the differentiation of chondrocytes and odontoblast differentiation, enamel organ formation, proliferation of dental lamina. So all these are the brief descriptions about the CBFA gene and its function. So the first function is it helps in the formation of osteoblasts. Second one is differentiation in differentiation of chondrocytes, and odontoblastic differentiation, formation of enamel organ, and proliferation of dental lamina. Now, arrest of both membranous and endochondral bone formation. So since there is a differentiation or mutation of the gene, the functions that are arrested are the membranous and endochondral bone formation is altered or arrested. Then there is an impairment of then there is an impaired chondrocyte differentiation, resulting in failure of cartilages which fail to mature into bone, and endochondral ossification. This is a distinct dental abnormality. Now, clinical features. So basically, if I tell you in a nutshell that this CBFA gene is getting mutated, because of which it is causing an alteration of the chondrocytes. Okay, chondrocytes. These chondrocytes form cartilage, and this cartilage matures to form bone. That is not happening. Chondrocytes are forming cartilage, but the cartilage that is formed is defective, due to which it is not maturing into a proper bone. Okay, then coming to the clinical features, characteristic feature is abnormality in the skull, clavicle, and jawbone. So it affects majorly 2 bones, that is your skull and clavicle. But here it also affects the jaws minorly. Okay, but since our interest is jaws, we are going to study only majorly on the clinical features of the jaw. So abnormality is in the skull, clavicle, and the jaw bones. Occasionally shunting of long bones also occurs. Shunting is decrease in the size of the long bones. Then clavicle. Now, complete absence of clavicles. In 10% of cases, clavicles do not form only, or if they are forming, they are partially forming. Okay, then thinning of one or both clavicles, that is your hypoplasia of clavicles. Muscles associated with abnormal clavicles are underdeveloped. Obviously, if the underlying bone, that is your clavicle, is not developed properly, then the muscle attachment to the bone will also not be strong and will be underdeveloped. Coming to all these defects, unusual mobility of shoulder causes. Okay, so these defects, that is your for deformity in formation of clavicles, then underdeveloped muscles, is leading to an unusual mobility of the shoulder. Now, tendency of patients to bring their shoulders forward, they meet in the midline. So since there is a defect in the formation of the clavicle, when the patient suffering from this particular disorder, when they try to bring their shoulders forward, the shoulders actually can meet at the midline. If you try, a normal person will not be able to meet their shoulders, but these people who are suffering from this disorder will be able to meet their shoulders because of the malformation or sometimes absence of the clavicle. Okay, then coming to the skull is a large head, pronounced. So what is the skull bone looking like? It is large, pronounced, and the bones of the skull, that is your frontal bone and parietal bone, bossing is seen. So basically bossulated appearance, that is, it looks like a bossulate, sorry, just a second. So it looks like a bossel, so it has a bossulated appearance, so bossing is seen in, and so there is a bossulated appearance of the frontal and the parietal bone. Then there is ocular hypertelorism. Okay, so ocular hypertelorism, for those of you who don't know what a bossulated appearance is, I am going to tell you what a bossulated appearance means. So bossulated appearance is a surface that is covered with a small nipple like protuberance, something like this. Okay, this is called bossulated appearance, and it is irregular or bumpy or usually a knob like structure. Okay, I'm just telling you in detail because bossulated is sometimes misunderstood. Then coming to ocular hypertelorism. Ocular hypertelorism is a congenital craniofacial condition where there is a wide distance between the two eyes. So the two eyes, like if we see, our two eyes are beside the bridge of our nose, but even the people who have telorism, their both eyes are a wide distance apart. Then broad base of the nose with depressed nasal bridge. Broad base of the nose with depressed nasal bridge. Okay, so something like this. Depressed nasal bridge. Then the fontanelles are large and remain open or show delayed closure. So fontanelles are usually present in children, and you have to know what fontanelles are to understand which they are large and they remain open or show delayed closures. Okay, then secondary ossification, basically I'll tell you what fontanelles are. In children, the unossified bone which later ossifies have an ossifying center or an area which is going to be ossified. Those areas are called fontanelles, which eventually ossify. Sometimes they fail to ossify or they remain largely open. Okay, in this syndrome. Then in this disorder, then there is secondary ossification centers. Many Verminian bones are seen. Okay, so Vermian bones are seen. Okay, then secondary ossification centers appear in suture lines. So secondary ossification centers can be seen in the suture lines, and something called as Vermian bones is seen. Vermian bones are small extra pieces of bone which are found inside the suture. Okay, so I'll just write here, these are the extra pieces of bones found in the sutural lines. Okay, yes. So abnormal development of temporal bone and conductivity or sensory neural hearing loss. So towards the temporal bone there is a neural hearing loss, and eustachian tube bone or eustachian bone is also not well developed. Then oral manifestations include narrow high arched palate. So if we have to specifically talk about the jaw, the palate is narrow and high arched. It is underdeveloped. Lacrimal and zygomatic bones are also underdeveloped. Okay, then you occasionally see cleft palate in these kind of patients. Prolonged retention of deciduous teeth and delayed eruption of permanent teeth. Sometimes complete failure of eruption of these teeth could also occur. Then roots of the teeth are short, thin, deformed. Okay, then abnormal spacing in the mandibular incisor area. Okay, so there is a lot of spacing which is seen in the mandibular incisor area because of the widening of the alveolar bone. Partial anodontia is seen, that is, anodontia is missing tooth. Few or more missing tooth are seen, and numerous, sometimes supernumerary tooth are also seen. Then other skeletal abnormalities include defective vertebral column, pelvis, and extremities. Then radiographic features include skull radiographs have a wide open fontanelle as we discussed, and sutures with numerous persistent woven bone. I gave this a term, that is your Vermean bone. Okay, then coming to the chest radiograph, or here we mainly see your clavicle, absence or thinning of clavicles, appearance of two fragments with a thin down midline portion. So there is fragments, if it is present in fragments, and very thin clavicle is observed. Then jaw, coming to the jaw, presence of numerous unerupted permanent teeth. This is known as anodontia, and we have many supernumerary teeth. Exhibit distorted crown or root shapes, and you can also see increase in the jaw size. Right, increase in jaw size. Mandible is coarse trabeculations with area of increased density. Additional osseous malformation is seen. Rami is narrow. Coronoid process is slender and pointed. Maxilla is thin, zygomatic arch. So if you see maxillary bone, the zygoma of the maxillary bone is thin. Sometimes the maxillary sinus is small to absent. Treatment and prognosis, there is no specific treatment. Age, it is left on the age to heal. Oral rehabilitation is important. It is if the retained deciduous teeth are there, they are preserved and well maintained, since permanent teeth may fail to erupt even if you go for an extraction of the deciduous tooth. In favorable patients, unerupted permanent teeth are surgically exposed, brought in position by orthodontic means. Performed before adulthood to prevent short lower face height and mandibular prognathism. So any change has to be, if it has to be done, it has to be done before adulthood, because then there are a lot of complications that you will study in orthodontics. In female patients, complications may arise during delivery due to narrow pelvic bone. Okay, I'll just show you a few pictures of how these patients look, so you will have an idea. So here are a few pictures. As you can see, there is an absence of the clavicle, because of which these shoulders are meeting with each one another. Okay, then there is sometimes anodontia. All these what you're seeing are your primary tooth, and then there is an enlargement of the alveolar bone, high arched maxilla. Okay, these are all the anomalies that you have to refer to when it comes to cleidocranial dysplasia. Okay, so yes, that's all for this video. If you liked Please do subscribe to my channel and keep watching for more such videos. Thank you and subscribe to my channel.